Just an introduction for myself. I'm Ben Howlett. I'm the Chief Executive here at IQVIA and Chamber. IQVIA Policy Institute and Chamber has worked with IQVIA for many years now in terms of doing these events around the country, bringing people like yourselves together in discussions. And we just had a very informative roundtable, which I know Angela will be going into a bit more detail about in a minute when I hand over to her. Housekeeping, can I just say that there are no fire briefings due today, or fire test alarms supposed to go off today. If there is, for any reason, a fire alarm, you'll hear a loud siren, but then also one of the people from upstairs, a fire warden, will come and get us and then direct us out of the building. So panic not, they will look after us. First of all, there has been a big change to the agenda, a very pleasant change to the agenda tonight, in that we were expecting Jenny Minto, the Minister for Public Health, to join us this evening. Jenny has unfortunately pulled out owing to the debate on Israel and Palestine that is going on over the road, so is unable to join us. But may I just say, it's a huge privilege to be able to introduce our new keynote speaker tonight. Not that he was aware he was going to be a keynote until about half an hour ago. So I have to say a massive thank you to Ivan. But obviously, a man who needs absolutely no introduction. It's also quite difficult for me, given that I'm dyslexic, with what your previous title was as a minister, which basically was everything. I find in Westminster it was very difficult to keep on top of one brief, so God knows how you ended up keeping on top of all of these briefs, Ivan. But we're very, very delighted tonight to welcome Ivan, who's able to join us for a very short period before he has to go over and vote too, giving his reflections in respect of his previous brief and also some thoughts around how we bring down waiting lists. So Ivan, over to you. Thank you.
Thanks to Curia, Chamber and IQVIA for putting on this event and for asking me to come along and take part on it. And it's been indicated by an excellent panel discussion next door earlier this afternoon, and I know that the panel are all warmed up and raring to go, so I think you're in for a really good discussion this evening. So it's great to be here at this Innovative Solutions for Scotland's Population Health Challenges, a mouthful, but hugely important issue on a number of levels. First of all, if you look at this from a government point of view, health is frankly the biggest show in town. It's what consumes the lion's share of the Scottish Government's budget, and that percentage is increasing year on year. I don't know where that ends up, but if you project those numbers forward, it's quite dramatic. So that is absolutely the key part of the government's focus in terms of resource allocation across the whole health and social care agenda. But also from a political perspective, and you'll know this better than me, but the challenge of tackling waiting lists, in particular the performance of the health service and how the citizens of Scotland see that and perceive it, is probably the single biggest thing, alongside, let's say, the cost of living crisis that chimes on the doorsteps. It's what most people are concerned about, and everybody in the country has got a family member or a close friend who's one of the, I think, 800,000 people now on waiting lists of one sort or another within Scotland. So it's absolutely the key challenge, and addressing that and fixing that is something that certainly government recognises and is very keen to play its part in. And I know that Caroline will talk to that in a bit more detail as we move forward. Of course, this is all compounded by demographic trends, by trends in diseases, trends in health inflation, of course, which means that those solutions, and trends in technology, which means that those solutions, yes, become more available, but of course the cost of them and the expectations from the public, as you know very well, are that those should be available. So that cost pressure is absolutely always there and increasing. So the route out of that, to a large extent, is through innovation. It's how do you use the technology, the expertise, the business, the technology and expertise that we have within Scotland to be able to address those challenges, and how do we roll out those solutions at scale and at pace. And I just want to touch on some of the aspects of that, in particular around about where Scotland starts from, because you can paint that gloomy picture, opportunity, if you will, of the things that we face and need to deliver on. But we do start from a good place. In terms of our universities, and I know there's many representatives from some of Scotland's excellent universities in the room this evening, the best universities in the world in many ways across certain aspects of the life science sector and the research and development that goes on there. How that research is then used and spun out for start-up businesses, spin-out businesses from universities, how they're established and then grow with their innovative solutions is an absolutely key part of that solution. But also, of course, the presence of many global businesses within Scotland. Scotland has great success in attracting foreign direct investment within the life science sector to over many years for businesses to base themselves here. And altogether that creates a sector which I had the pleasure and the privilege of being the co-chair of the industry leadership group within Scotland, a sector within Scotland that has that combination of that research excellence in our universities, very dynamic and vibrant start-up and spin-out businesses across a range of subsectors alongside those inward investment businesses, alongside some excellent infrastructure, be it innovation centres that we have covering precision medicine or digital health. The Medicines Manufacturing Innovation Centre recently opened down in Shannon, and a whole soft infrastructure that sits alongside that. And Dame Anna will talk to more of that around about Anya and the Innovation Design Authority, which allow us to take in those innovative solutions and roll them out across the health service. And I think the biggest single thing that sits in Scotland's strength is our ability in a country of 5 million people to reach out and join all of that up. As I said, I was chair of the industry leadership group, allowed coming together of government, NHS, academia and business, that triple helix that we talk so much about, to be able to cooperate and work together to take those solutions forward. And I think that's absolutely something we can build on. And I've seen real developments right across that cooperation and right across the capability to take that innovation forward across the health service over recent years. That innovation can be very high-tech. We talked about artificial intelligence and some advances in medicine, but also can be relatively low-tech in some of the application of digital solutions in the social care environment are basic technologies, but applied effectively can make a real difference to the efficiency and the effectiveness of service and care delivery across the sector. And you'll hear a bit more about some of the technologies and the products and services that have been rolled out across the sector over recent years and continue to be so. But just to finish off, I think there's a number of challenges there. Though that excellent technology and research, those fabulous businesses with their great ideas, getting a foothold in the NHS and being able to start and find somewhere where those technologies, products and services can be initially trialled is something that we're getting better at. But how you then take that to scale, how you roll that out across all health boards across the country is a challenge, absolutely something that needs to be addressed. How you do that at the pace it's required to be able to address the challenges and waiting lists that we're all familiar with, and how you do that at scale to get many more of those innovations coming into the pathways that Dame Anna is going to talk through with you some more as we go through this evening's session is absolutely the challenge that faces us. Now, I believe that can all be done. I believe it requires real cooperation and collaboration across all parts of the sector and everyone that's involved in this. I believe it requires, frankly, some of the attitude that was prevalent during COVID, when things that were thought impossible were delivered in a matter of weeks that otherwise would have taken months or years. That approach, I believe, can deliver those solutions at the scale that's required to shift the dial and make a real dent in waiting lists. The importance of data is absolutely central to that. How we understand what the data tells us, how we break down the barriers that prevent access to data and the ability to cross-refer data sets to understand what's it telling us about the success of the rollout of new products and innovative services, but also where it points us to in terms of what some of the solutions might be in terms of cross-linkages across various data sets and cause and effect. So all of that is, as I said, I believe there to be addressed. I've every confidence that the sector working with the NHS and working with government can deliver on that challenge and make a real significant difference to the lives of the people of Scotland and addressing those waiting lists that we all know need to be dealt with sooner rather than later. So thank you very much again for the opportunity to come and talk to you. Hopefully that sets the scene on what you're going to hear over the next hour or so. And I shall hand you over to Angela, who will take us on and introduce the panel. Thank you very much, everybody. Thank you.